Good morning, good afternoon, and good evening to all of you wherever your time zone is. Let me first introduce myself. I am Adolfo Rubinstein, a family doctor, epidemiologist, implementation researcher, and a former policymaker in my country, Argentina. Today, we will try to navigate through the turbulent waters of the implementation of policy change just to introduce some poetry into this lecture. Here we will learn about the role of scientific evidence in policymaking. Is it that important or depends on the strength of evidence or other contextual factors? How an idea's time comes, how to recognize a problem, generate a policy, or understand the politics behind. For instance, in the multiple stream framework of Kingdom and American policy scientists, are these streams independent? What happens when they align? How is the agenda set? And how to open a window opportunity for adoption? In the last part, we will talk about how to make a political analysis and a political strategy taking into account the players, the stakeholders, the position of each stakeholder, the power, the vested interest, and the public perceptions about them. And finally, I will tell you about a personal journey I made from research to policymaking. Most of the researchers think that once you publish a paper in a journal, especially if it is a high impact journal, the evidence will pass through a process of natural diffusion of information and serendipitously it will translate into a change of the policy or the practice. Let me tell you that most of the time this is wrong. Why? Because to go further from research into a change in policy and practice, it is also necessary to map, analyze, and engage key stakeholders whose interests can be affected in any direction and develop, finally, a political strategy. Doing this way, the chances to remove the barriers, implement and scale up the intervention at a health system level, and be able to change the policy or the practice are much higher. But even when the evidence crosses all the barriers, most researchers may think that scientific evidence is the main driver to change policies and practice. Wrong again. Most of the time, other type of evidence, so-called colloquial or contextual evidence, are equally or even more important than the science behind the decision making. The influence of scientific evidence in the decision-making process is not the same when facing decisions on clinical practices, healthcare organizations, or large and big policies. It's like the inverted pyramid you are watching in the right-hand side of the slide. For clinical practices, decisions follow a kind of a linear model or of relationship between evidence from research and implementation beyond the barriers of efficacy found in classic RCTs to intervention effectiveness in the real world. At the level of healthcare organizations, decisions have a weaker relationship with scientific evidence because the implementation of health services is multidimensional and are very, very sensitive to the influence and powers of the actors. And finally, decisions on large policies are a different business. Here, the role of scientific evidence is minimal. It is strongly influenced by ideologies, values, power relationships, and interests of different stakeholders. And also financial motivations, economic theories, ease of political implementation, and also fashions rather than science. Of course, the stronger the evidence base and the bigger the political skills of researchers, the larger the chance to move research evidence into actionable policies. In other words, implementation research intends to bridge the so-called no-do gap, when interventions that prove to be effective in clinical and controlled research settings are not actually implemented and scaled up in the real world. And as I said before, even when you cross the no-do gap bridge, this is only part of the journey, an important but just an intermediate station. To go further, looking for the policy adoption and above all implementation, as we saw at the beginning of this lecture, you have to engage the key stakeholders, consider the healthcare and the political context, the prevailing ideas, the agents, institution, interest, and also ideologies and fashions, as I said. According to Kingdom's multiple stream framework, successful policy change occurs when the three streams of events come together. One, the objective situation, the problem stream. Two, the availability of a possible solution, the policy stream. And three, the flow of political events, the political stream. When these three streams converge, some policy response is likely to result. And here you can see the whole framework, the problem, the policy, and the politics, how they align in order to open a policy window to enter into the agenda. However, as you can check, another stage is triggered with the involvement of key players for the evaluation of the alternatives that have been negotiated for adoption, and finally, just finally, pass along the way to the implementation stage, which in turn depends on the work of the implementers, who are not usually those who design and plan the intervention program or policy. So let's start with the problem stream. What is a problem? From the perspective of policymakers, problems are conditions that people find unacceptable and want to change. But from the perspective of epidemiologists or researchers, a problem may be something very different. Perhaps a health condition that has a high burden of disease, for instance, cardiovascular disease. And for the people, maybe not a problem. And therefore, if it's not a problem for individuals, it's not a problem for policymakers either. The translation of health conditions into political problems, therefore, occurs when individuals recognize that that is important and demand that the government pays attention to their concerns. So, from the perspective of the people, we have to think about what is a problem, why does it matter, to whom does it matter, who needs to care more, how do we get them to give it more attention, or how do we measure it or tell stories about it. What will the problem look like when it's solved? The policy stream focuses on the availability of a possible solution and the alternatives. Policies are tools that operationalize problem solutions, laws, decrees, resolutions, protocols. When analyzing policies, it is important to check who is affected, what is the cost, how does the tool fit the perception of the problem, or how does the tool fit the evidence of the problem. Big P when addressing large policy changes, such as establishing a national hypertension control program, and little p when addressing a new protocol or a clinical practice guidelines for a hypertension management. Politics allow for the flow of interaction among the key stakeholders that are behind the formulation, adoption, and implementation of a policy. And there are many definitions of politics. A simple definition is who gets what, when, and how. So it has a focus on the actors, the stakeholders, the materials, the timing, the process, and how the players distribute and redistribute available resources. And most importantly, politics is also about the use of power to get what, when, and how. I would say that there are three aspects in the process of changing policies that can be highlighted in this lecture. Political will. Frequently one hears that the failure of a public action on a particular problem is due to the lack of political will. Usually this means that some politician has not shown sufficient personal courage or strength. Not at all. Political will is important. I would not deny that. But successful policies are not necessarily dependent on strong political will or the lack thereof. Political will, as it personalizes the change, emphasizes individual leadership and suggests that all it takes for leaders is to have the will to change things. The assumption that the leader makes a decision and things happen most of the time is not true. Changing policies need more. And as a matter of fact, changing policies need first a good political analysis that usually involve stakeholder mapping and an evaluation of how political costs and benefits are distributed among stakeholders. Finally, once a political analysis is done and the stakeholders have been mapped, it is time to develop a political strategy taking into account the actors, the players, their individual power, position, vested interests, and public perceptions, as we will talk about in the next slide. The first skill is to assess the political intentions and actions of stakeholders. These players include individuals, groups, and organizations who have an interest in a policy and the potential to influence decisions. Political analysis of stakeholders need to consider all the individuals and groups that could be affected by that particular policy. So let's define who are the actors and what attributes should be considered to make this policy analysis. First, the players, the set of individuals and groups who are involved in the change process, in the game change, and might enter the debate of the policy's fate. Power, the relative power of each player in the political games based on the political resources available to each player. The position and interest, the position taken by each player, including whether the player supports or opposes the policy, and the intensity of commitment toward the policy for each player. For instance, the proportion of the resources that the player is willing to expend on the policies. So it's not just the whether the actor supports or opposes, but which is the intensity of their opposition or support. And then the perception, the public perception of the policy, including the definition of the problem and the solution, and the material and symbolic consequences for particular players. Here you have a stakeholder matrix where you can see four quadrants with respect to the position, in favor or against, and the power, high or low. Different political strategies should be undertaken according to the quadrant where each actor is placed. For instance, if you map a particular stakeholder as an opponent to the policy you are pushing and has high power and influence at the same time, you should be very careful at managing the dialogue, having in mind its perception in relation to the policy, and always you should try to negotiate. For instance, front of package labeling and food industry. Food industry is is a very powerful player. In general, will be opposed to front of package labeling. On the other hand, if a stakeholder is in favor, you should keep it informed. For instance, thinking UNICEF in the previous example as a supporter, or try to establish an alliance if you identify a powerful stakeholder, such as an influential champion. Finally, once you have mapped the stakeholders, you may shape the political feasibility by trying to change the power and the position of supporters and opponents, or maybe changing the players, if you can, that are engaged in the policy debate, and or changing the perceptions of the problem and the policy. These are the actionable interventions that you should do to open an opportunity window to make the policy challenge enter into the agenda. Finally, to open a policy window to put the policy in the government agenda is not an end, but just the beginning of the policy setting. In this regard, you need a good sense of the political timeline and the opportunities. Or maybe you can find a focusing event like a threat or a crisis such as COVID-19 pandemic, but always having in mind that there are contenders that will compete with your problem to raise attention in the agenda setting, which in turn, it usually can accommodate very, very, very few problems at the same time. And don't forget, again, that you need not only data, but also a very good storytelling. No plan survives to the first contact with its implementation. This is a statement that I have in my personal WhatsApp. This great phrase is not mine, but it was made by a Prussian general in the end of the 19th century when he was fighting a very important battle. In my case, I knew it when I read The Martian, a fiction novel of Andy Weir that inspired the movie with Matt Damon. And few things are more real. You can plan well what you know well. But if you have to deal with a complex challenge, like most of policy challenges, planning is doomed to fail. So you have to be prepared. In this picture, you can see Dr. Irasola, Vilma Irasola, whom you probably know as a professor of the GACD Implementation Research School, and me, presenting with other colleagues a landmark implementation research trial for hypertension control in Argentina. This happened in the most important and competitive session of the 2016 AHA meeting, the American Heart Association, one of the largest medical conferences worldwide. We presented a successful cluster trial, actually funded by NHLBI, but under the umbrella of the first GACD call. And we had impressive positive results on hypertension control in poor populations living in resource-constrained settings in Argentina. We were so proud. And at that time, our thoughts were on how we should approach policymakers in our country to scale up results and get to a policy change. Imagine my surprise 1 year later when the study was published in JAMA, and at the very moment I was the Ministry of Health of my country. No longer a researcher, but a policymaker who should now move forward with the adoption, implementation, and scale up of that hypertension intervention program in Argentina. Looking back, It was a very strange situation where serendipitously I jumped from one to the other side of the counter, from the research world to the policymaker world. Just think that this could also happen to any of you. Finally, to summarize, let me offer you some key messages to take away. First, there is no such a thing as a passive translation from research evidence to policy change. This is an active process. You have to work on this. Two, successful policy change occurs when the three streams of events come together: the problem stream, the policy stream, and the political stream. The way to do it is through the engagement of key stakeholders and developing a stakeholder mapping considering their power and positions. And finally, political feasibility is shaped by political strategies in order to change the players, the power, the positions, and the public perception of supporters and opponents. And as the philosopher Confucius said 2000 years ago, tell me and I will forget, show me and I may remember, involve me and I will understand. I hope you have enjoyed this lecture. Thanks and good luck in your research career and hope to see you in 3D in the next future.